and from where we have to get it and not to get it, and what extra things we are supposed to do when we do the Baga. So I am Dr. Kavita Bapat from Indore and the bus. A long time ago, I am just telling you a story. A lady diagnosed with a breast cancer and then underwent mastectomy. I am talking, this is the story about 15 years back. Then she took the chemotherapy, then she had a side effects, she had a recurrence and expired due to the metastasis. This was the story long back ago, number one. Then the breast cancer diagnosis, previously दो ही tools होते थे, the biopsy, HPE, the basic understanding of the morphology of the tumor. Now the time has changed. We have the immunohistochemistry, cytogenetics and a molecular biology. These three things have revolutionized everything over there. Now we have shifted ourselves from biopsy to the ISC. Now what these are the changing trends. Over the years, laboratory medicine have evolved. We have a targeted therapies. These two therapies have changed everything. Number one, MAB, that's a monoclonal antibodies, and this is a TKIs, is a tyrosine kinase inhibitors, have changed the way patients be treated. So this is the thing, and the most important point is no more one size fits for all approach. Now the changing needs of the companion diagnostics. They say the general medicine has been a precision medicine and we need a targeted therapies. Targeted therapies precisely work on the cancer cells only and they don't work on the collateral damage to the normal cells. So this is a needed, and the change of the need have been brought in the major changes they have called companion diagnostics. It's not the one thing, one BRCA करने से हमारा काम नहीं चलेगा. And molecular biology, so molecular biology detects underlying genetics alteration responsible for the malignant conditions and the mutation aiding in the therapy. So the story continues. Now the story has changed. What happened? Same patient, another lady was diagnosed with a breast cancer. Then she went for the surgery. Then she has tested for HER2 because the time has changed. And then she has undergone the targeted therapy. Usko kuch special therapy mili, that's a therapy. Then she faced a lesser side effect because she has been given a targeted therapy. Then has a longer survival. So the story between the two times has changed. पहले mastectomy कर देते थे, उसका recurrence हो जाता था, उसको फिर से वो चली जाती थी. But now the time has changed. Within a years, हमको diagnosis हो गया, patient surgery में गया, उसका immunochemistry हुआ, HER2 test हुआ, and then targeted therapy दी, and lesser side effects, and she has got the survival. So this is the latest thing which is there is a theranostics. This is a therapy of the laboratory report. इस तरह की report आया नहीं चाहिए कि that patient management was done, how to be done, and then HER2 receptor testing enabled anesthesia, and what these are the new drugs which are there and improved the 5 years more than 90% survival rate बढ़ा इसमें, and remaining these are the new drugs over there. Now the story continues. She says that the lady's sister was diagnosed with a breast cancer. Now this is another problem. Then she had two questions in her mind. Number one, what are the chances of my daughter getting breast cancer? This is the best concern कि BRCA किसका करना है, नहीं करना है. And another question is, can I avoid chemotherapy? Because see, breast cancer का diagnosis होना and breast cancer के लिए mastectomy होना या targeted therapy मिलना, the basic question is, कल को मेरी बेटी को नहीं होना चाहिए, मेरी बेटी की बेटियों को नहीं होना चाहिए, किसी को नहीं होना चाहिए, और वो जो कुछ ट्रीटमेंट दोगे तो मेरे को गंदी वाली कीमोथेरेपी मत देना. Give me a simple targeted therapy that should be there. So the answers are the possibility of daughters getting a breast cancer, get the BRCA test done. Can chemotherapy avoid it? Yes, they need a genomic testing. That's a more important point over there. Then the germline determination, why BRCA, one, and a prototype. We have to do the risk assessment. We have to do the disease prevention, and we need a therapeutics. So the BRCA and BRCA2 comes. Now why we are doing in a proportion of the cancer inherited? Number one, inherited susceptibility to the cancer is genetic, that's a 5 to 10% only, and this is a single gene. I am making it a very simple, घर जाके take home message रहेगा उसमें. Family history of the cancer, familial 10 to 15%, but it's a multifactorial origin. Then population at risk, breast cancer 1 in 10, ovarian cancer 1 in 100. And no family history. The worst part of the story, कोई हमारे घर में history नहीं है, कुछ नहीं है, and still there are the chances of cancer. They are sporadic cases and they are 80%, and there are the chances, as the discussion is being going on, maybe because of multifactorial origins, or there may be a chances of multiple genes are working over there. See the genetic overlap. There are so many things, BRCA1 and the number of things, the genes which I am not able to read them, but the multiple genes can increase the risk of single cancer. That's the one thing. And the multiple cancers can be associated with the single gene. So there is a two different things. There's a breast ka cancer, ovary ka cancer, gastric ka cancer, colorectal cancer. They can be multiple cancers, but the gene will be one. And same in opposite part, there may be multiple genes, but there may be only one cancer. So this is the part, and this is the hereditary breast cancer. The BRCA1 and 2, 25%. 5% rare cases with these are the genes PTEN, SKI22, and these are the genes, and 70% are the low risk, but a common mutation, moderate risk genes, and these are the points. Now why to test BRCA? Because why we want to test the BRCA is breast cancer in a lifetime 30 to 85% in a women, पर जिनको BRCA है उसमें 12 to 15% ही है. Same with ovarian cancer, normal lifetime risk 40 to 60%, पर जिनका BRCA positive है उनको only 1 to 2%, and even in a men there are 5 to 10% chances and 0.10 with this thing. Now these are the BRCA1, it's associated cancer with a life risk. Breast cancer 50 to 80% when we talk about 1, and when we talk about 2, the breast cancer is 50 to 85%. Now who should undergo the testing of BRCA? So it's not a one thing. So the recent nice guidelines say it's a near population risk, women with a moderate risk, and high risk. So the high risk, I am not going into detail, but I'll show you some few diagrams which will try to know. But the high risk are 2 first degree relatives, 3 or more 1 first degree relatives, 1 first degree male relative, very very high risk, 1 first and second degree relative with ovarian cancer. These are the points. And then Jewish and all, that is not concerned to our country, but still it's important. Then the moderate is first degree and second degree diagnosed before the age of 40, and 2 first degree relative are their population risk. Now see, these are the breast cancer study. Ye husband wife hai, and if the pointer is there, the another one is she is the wife, and she is having the breast cancer, CA breast, diagnosed at the age of 54 years. Now her daughter, she has been also diagnosed CA breast at the 52 years of age. Now this family is really devastated. उसको भी हुआ, उसकी बेटी को भी हुआ. Now जिसको हुआ उसकी 2 बेटियां हैं, one is 20 years old and one is younger. Now the problem is इस किसका ब्रैका कराएं या मेस्टेक्टमी कराएं? Previously वो बहुत फैशन आ गया था बीच में, वो the film star or some Jolly, and she did the mastectomy. I think it was a really criminal. That's not needed. What I feel in the heart of heart, और in a जमाने में जहाँ 25 चीजें और हो सकती हैं, why to get all this and to make a this thing? But there may be things which I should not talk about. So these are the point. Now these 2 females, इनका BRCA होना है या नहीं होना है, number 1. So they are definitely the moderate risk में आ रही हैं, because first relative को उसको CA है and second को first degree relative है. So the patients requesting the question is considered the prophylactic mastectomy. She wants कि मेरी बेटियों की mastectomy होना चाहिए. What are level of risk and what is the appropriate management of a risk, and patient is also interested in genetics testing, and that should be offered or not to offered. This is a very important point. Same thing, same study is going on. ये husband wife हैं, CA breast died at the age of 40 years. This is the second study. Her brother's daughter again diagnosed with a CA breast at the age of 32 years. Now what a family can offer? This is a really a common thing. जब हम हिस्ट्री लेते हैं कि we find it out, मदर को मेरे को हुआ है, उसकी बुआ की बेटी को भी हुआ है, like sort of thing. So what we are going to offer to this family? So the recommended screening, initially the breast cancer किसी को हुआ and died at the age of thing. If she is having 2 daughters, 100% recommended screening is needed. If her brother's daughter CA breast diagnosed at the age of 32, blood taken for the BRCA, and that's more important, and another daughter, she needs a recommended screening. So this is the another breast cancer study, and what about her daughter is also important. Again the third thing is a third study, or you can say same study in a way. First एक daughter को CA breast diagnosed हो गया at the age of 35, other daughter को कुछ नहीं हुआ है. Same with the brother's daughter, CA 32, BRCA testing ongoing. So and the BRCA mutation was found, the BRCA mutation carrier, and she is a BRCA mutation carrier also. So why genetic testing shows the increase into the cancer risk? If your genetic test should be possible for the gene mutation that could increase the risk of cancer, managing the risk should be go for the priority. We need a good chemo prevention. We need a prophylactic surgery. We need a changes of a lifestyle and a cancer detection test, awareness, MRI and everything, and screening to the other relevant members in a same mutation. So this was the thing which is the bilateral molectomidum. But now, what genetics testing? People will lose the what I am saying. It's a very important topic. I think मैं raise करा लेती हूँ हाथ की पूरा सुनना चाहेंगे कि नहीं. Otherwise I'll stop it. Am I right? So the genetic terms is specific inherited changes. Variation can harmful, beneficial and now the effect of mutation. There is a very simple thing of mutation कैसा होता है. Wild type का the cat sat on the mat. Substitution होता है the rat sat on the mat. And insertion होता है the cat spat on the mat. So you can understand बहुत छोटी छोटी चीजें बदल जाती हैं और the mutation हो जाता है and the things are there. So the genetics testing again, how genetic testing done? I think the doctor who was taking the panel discussion, she was nicely talked about. बहुत छोटी छोटी तरीके से होता है. Request करते हैं हम डॉक्टर को blood test and testing is done with a blood or the fluid. Very simply it happens. The sample is taken and the specialist and the consent form is being taken. Now how the genetic testing done? They usually take 3 to 4 weeks. Laboratory returns the test and the doctor and the genetic counselor requested about the laboratory to send the patients, and then the pre and post genetic counseling is also important for the care. Now what analysis they do? They just take a blood sample, उसमें से DNA को cells में निकाल डालते हैं and they give us the mutation BRCA का बताते हैं. बहुत छोटी सी बात है. They just blood में से cell लेते हैं, cell में से DNA निकाल डालते हैं and the BRCA का testing हो जाता है. So these are the genes. There are colorful pictures only. I don't know anything. I can just put it like this. But क्या कौन सा वाला this thing mutation ऊपर जाता है, nucleotide ऊपर जाता है. Now the role of breast cancer में BRCA it causes DNA repair, cell cycle arrest, cell death and genome stability. So BRCA mutation हुआ, so it missing or a non-functional protein, and these are the, so there are different mutation types. Several hundreds of the things are a BRCA1 and BRCA2 genes, and they are there, and as a small decisions are being taken. The some found mutations are there, and in islands almost इतने 75% mutations होते हैं. In Finland about 6 founder were in a BRCA2 में defined होते हैं और Israel में 3 होते हैं. So these are the texting method में वो करते हैं, sequencing करते हैं, MLPA करते हैं और NGS करते हैं. So I am not going into it, but what is important for all of us, I will like to tell. Now how to report and how to treat. These are the 5 points they talk about the report. In a report they talk about it is a pathognomic, likely pathogenic, uncertain significance, it's likely benign and benign. ये सारा नया टेक्नोलॉजी का टर्म है and these are the classification of the mutations over there. But what are the drawbacks? हम अकेला BRCA करके नहीं मानेंगे because we have to do the multi-panel thing, because the multigen testing is inherited cancer and a sequencing, and this is NSGS, this has come, it's the next generation. And सिर्फ हम एक BRCA2 करा के नहीं चलेगा. We have to get the full panel done and we have to report it in all the points. And this is the way they report it कि class 1 क्या है, class 2 क्या है, class, because it's not like that कि आपको BRCA की रिपोर्ट दी, शाम को मेरी समझ में नहीं आ रहा है कि क्या ही करना है मेरे को रिपोर्ट पढ़ के. I should be able to tell and counsel my patients in future what treatment you are going to do, how you are going to be treated, what is the life and what are the things will be there. And these are the definitely the guidelines. I think the time is less. So all of us can read these guidelines from this, but the basic guidelines which I already covered being, and the thing is this is the breast cancer, this is not a simple thing, and these are the relative lists with the multiple channels, and the multi-gene panel is future, and they have called it as a mama print. Mama print is in a future, they give a full panel list and everything about this. This is a genome assay they do, and so many risk satisfaction and metastasis and how they find it out. So this is the mama print, they do it in a full manner and they tell कि कौन सी chemotherapy यूज हो सकती है, किस वाले targeted therapy one can be given, where to be treated, how to be treated, what to be the counseling is very important. And these are also the recommendations of SCSO, and this is the mama print. So I'll just put it in a point. These are the few things कि testing होने के बाद हमको familial पता लगाना है, no लगाना है, genetic testing लगाना है, and so many things are there. And these are the lines. So I'll just take home message as a conclusion. Number 1, Genetic testing can be useful for the patients with their family members, both to prevent and treat the cancer. We cannot leave the patient, we can only diagnose. No, we are supposed to treat also. The genetic testing is a continuously evolving, and BRCA1, BRCA2 mutations are the most commonly found, and we have reasonable data on the hand to manage. Then the third point is the last is the new genetic tests are often less clear in the terms of patients, care and improve the patient outcome. The variants of unknown significance stage should be managed, and there should be a phase of prophylactic need to emphasize the patient's how mutation of the BRCA. So it's a small video. If you like, I can show you, otherwise I'm